Welcome to Healing, Hope, and Health. I'm Bernadette Wagner, the Community Outreach Coordinator for Hospice Washington County, and I'm so glad you could join us for today's program. As many of you know, 2015 marks Hospice Washington County's 35th anniversary. That is to say, 35 years of providing compassionate care to those with limited time and their family members. Additionally, for many of those years, Hospice Washington County has been offering bereavement support to those coping with the death of a loved one. Much has changed since the organization's humble beginnings in 1980, but its emphasis on providing compassionate care and assuring a dignified death to every person has remained unchanged. Today, I'm pleased to welcome Judy Lyons-Wolf and Kay Hoffman, who are HWC's first paid Executive Director and Development Director, respectively. They join us today to share their recollections of the organization's early years and to compare those years with Hospice of Washington County of 2015. Welcome. Thank you so much for being here.
Thank you.
Thank you.
So maybe you could just start us off a little bit telling us about where you were and how you came, each of you, your decision to go work for Hospice of Washington County.
I had moved to Washington County in 1978 and was tired of driving the train, and I had taken a leave of absence to take care of my mother, who died at home as she wished, with wonderful palliative care from her children, her 6 children. And I had decided to be a nonprofit executive.
And that was the beginning.
And there was a little tiny ad in the back of the Herald Mail newspaper in those days. That's how one job hunted. It said, Hospice Executive Director sought. I came to an interview on a late August, hot summer day on the 2nd floor of the Presbyterian Church building, and the rest is history.
So let me ask you, your background was law. So you're an attorney, and so you were moving from a legal practice into nonprofit executive. Okay,
right.
All right. Kay, how about you?
Well, I came, actually I had worked for the American Cancer Society and dealt with a lot of families who had terminal illness, and became very interested in the hospice movement as my father had passed away from cancer and was a long terminal illness. So I was very interested in the movement, and at that time I had a very young child at home and decided I just wanted to work 2 days a week, and it just happened to be a really good fit for me.
So you were a 2-day paid employee at Hospice,
yes.
And were you full-time, Judy, do you remember?
I can't remember.
Okay.
It felt full-time. Whether I was paid full-time is
Okay.
another story.
All right. I read in the archives that Elizabeth Kubler-Ross, and you mentioned it as a movement. It had been quite a movement across the country, this idea of death with dignity and being able to die at home. I read that Elizabeth Kubler-Ross came to Hagerstown to speak. I was wondering if you remember that and if you could share your recollections about that.
It was extremely exciting. She was a big deal in the late 70s.
International speaker, yeah.
70s and 80s. And the hospital and hospice invited her, and she said she would come, and the Maryland Theater was sold out.
That's great.
1,200 people. It was a really fantastic evening, talking about the 5 stages of grief. She was just really inspiring. But the crowd and the excitement's what I mostly feel remembering.
How about you, Kay?
Well, I wasn't on board at that time, but I remember when that happened, and I think that really helped hospice attract more volunteers, because we were strictly a volunteer organization. As you noted, just a few of us were paid, and most of us were part-time and most of us worked full-time.
So speaking of that, you had how many? 3 paid staff people?
Probably when we started there were 3.
Okay. And today we're at 131.
That's
But how many volunteers did you have?
We had 100 volunteers.
And that was in 1987 when you left, right?
Yeah.
And I think today we have 185 volunteers. But I do think it's interesting because we have so many more paid staff. I imagine some of your volunteers were doing similar roles to what our professional staff is now doing.
Many of our volunteers were doing roles similar to your nurses and CNAs.
So you had nurses who were volunteering, doctors who were volunteering.
Well, we had Rick Cass as our medical director from the very beginning. He was on board when I arrived in 1982. and showed up at our weekly team meetings and when we discussed the patients. There was no reimbursement, there was no hospice licensure. We were inventing the wheel for hospice in Maryland and in the county. And
at the forefront of the country too, because it was new across the country. I know now that hospice has gone through numerous accreditation processes, and in fact last year was the top hospice in the state of Maryland. And I know that we got to where we are today because we had a strong foundation. Hey, I wanted to come back in just a few minutes and ask you about some of the people who worked with you in those early years, but I'd like to take a short commercial break so that we can come back and enjoy some more stories. Stay with us, we'll be right back.
I'm the hometown favorite.
I'll outsmart you.
I will beat you.
I'll be surrounded by fans cheering me on.
There's no place like home for fighting cancer.
My turf.
My time.
My team.
Expert care, close to home. The John R. Marsh Cancer Center at Meritus Health.
Harbor's Carsons Jewelers has been your community jeweler for over 110 years. We have the region's largest selection of diamonds, designer jewelry, including bridal, gold, and silver fashion jewelry, and fine Swiss timepieces. We strive to combine quality, expert personal attention, and affordable financing to create an exceptional shopping experience aimed at exceeding your expectations. At Carsons Jewelers, there's something for everyone that will bring a smile to that someone special in your life.
Hi, I am Dr. Olenzak at the Pain and Spine Institute. I specialize in the most advanced procedures and technology available in pain management. At your visits and procedures, you will always see me for continuity of care. I would like to thank all of my patients for allowing me to provide you with the specialized care that you need. To give you this level of care requires a team. This is your team at the Pain and Spine Institute. To become a patient, call 301-739-7900 or go to painfree-md.com.
Welcome back. If you're just joining us, we're talking with Judy Lyons-Wolf and Kay Hoffman, two of Hospice County's first paid employees. So Judy, during the break you mentioned a story that I thought our viewers would find interesting about hospice's licensure. Maybe you could tell us that.
When we started, we survived on grants and donations. There was no such thing as reimbursement, and the reason was there was no licensure for hospice, no reimbursement. So we went to Annapolis, mostly Prince George's County Hospice and Washington County Hospice, and lobbied to get hospice licensure. The legislative session of 1986, we did it in one session. Daily, weekly presences in Annapolis, a lot of help from then Senator Don Munson and the chair of House Economic Matters.
So Hospice of Washington County and Prince George's Hospice were the first two counties in the state of Maryland to get licensure?
We were certainly the lead lobbyists.
Okay, that's great.
And I would imagine we got the first licenses.
I'm sure all those families that we serve appreciate that you did that. So I wanted to get you both to tell me a little bit about some of the early players in Hospice of Washington County. I know Bobby McCluskey, Dr. Rick Cass, Faye Altizer. What do you remember about those early years?
I remember that Jim Witherspoon was Mr. Hospice.
Okay.
I think he got the idea. He convened the first group of people who became the volunteers and the first board. And I guess he was on the board in 1982 when I arrived. Reverend Joe Donovan was chair of the board at that time and was chair for a long time, through the 80s at least. Anita Martin, Reverend Martin's wife, was our volunteer coordinator.
Anita Masters.
Anita Masters.
Yes.
I knew Martin was.
Who was Anita
right.
Masters? Oh,
Anita Masters was actually our volunteer coordinator,
Okay.
and her husband was a pastor who just recently passed. And Anita's still very active in the community. I see her often, but she did a wonderful job of bringing new people in. I mean, our volunteer base was really the working bees of hospice. They came in, they did almost all of the secretarial work and were out visiting patients, and it
So
was
did
a
they
great
do
time.
the bulk of the administrative work back then?
Probably a lot of it, a lot of it. Yeah, because there wasn't until Nancy Melton came.
Yeah, sometime in the
Yeah.
mid-'80s, we hired an office manager, Nancy
Yeah.
Melton. But before that, the volunteers wrote thank you notes for donations, answered the phones, kept the office running.
Did they do your accounting and?
They must have entered on the accounting books, but we had a wonderful and very active treasurer who signed paychecks. He was Jamie Nykirk, a business on Franklin Street next to the post office.
And who? Tell me about Faye Altheiser's role.
Oh, Faye was our very wonderful first bereavement coordinator and developed the
And when
bereavement
did she
program
start?
that's still so famous. She would have started around the same time I did, or just maybe before even. She was always part of hospice, running our bereavement program.
And I think that's such a critical part of hospice, and a lot of people still don't know that that's there for the whole community, whether or not your loved one has hospice services or not. You know, those bereavement support services are there for anybody who is coping with the loss of a loved one. And I'm so grateful that Faye started that. I was wondering, did you have chaplains or social workers back in those days?
Well, Faye was a social worker. I guess Joe Donovan.
There were an awful lot of
People wearing two
from
hats?
the religious
Yeah.
community. Whether we called someone a chaplain, I don't recollect. We had Reverend Masters, Reverend Donovan. We had very close ties with the social work department at the hospital.
Okay.
And
I think at hospice now we have 8 social workers and 6 chaplains, but of course they're serving 280 patients a day,
Right.
so all their incredible work makes a huge difference for our families. We have just a little bit of time. I was wondering if you have a short story that you wanted to share that was particularly meaningful to you.
I have a vivid memory, Kay probably has another one, of the first AIDS patient in Washington County being a hospice patient, and how at that time AIDS was an
Scary.
infectious disease and everyone was frightened, but Linda Smith resolutely told us that we were managing this patient and making his days as lovely as he would have wanted them to be. He was Fred Hansen, an antique dealer in Keedysville. And it was such a moving thing to do. I remember his memorial service. I remember everything about it.
That's neat. How about you, Kay?
Well, mine's not going to be a patient story, but as the development director, we did the very first Taste of the Town in Washington County, and I remember it well because you never know what you don't know, and we had it at St. Marie Goretti's gymnasium, and was very well attended, and it was just a great opportunity for hospice to share our story and to bring more people in to learn about what we do.
That's great. Well, thank you both so much for being here, taking time from your busy day. I'd like to thank Judy and Kay for taking time from their day to be here with us and for the seminal role they played in establishing Hospice of Washington County. From an all-volunteer organization in 1980, serving just 3 patients per week, to an organization with 131 professional employees, compassionately caring for 280 patients per day, the organization certainly has grown. It's been a great 35 years. As hospice reflects on 35 years of providing care to our community, it's pleased to invite you, the public, to its 35th anniversary reception and art exhibition to be held on October 18th at Fountainhead Country Club from 2 to 4. This event will be a commemoration of the organization's history and an exhibition for the 10 pieces of art selected as finalists at HWC's 35th Anniversary Art Contest. Except for the winning piece, which HWC will use to create a commemorative poster, all the other works may be available for purchase. I hope you will consider joining us. You can stroll by HWC's 35th timeline and take in the art exhibition. Come and enjoy delicious hors d'oeuvres, beautiful chamber music, and fantastic company. The highlight of the afternoon will be, and the culmination of the celebration, will be the announcement of the winning artist who will receive $350. If you would like to purchase tickets to Hospice of Washington County's 35th anniversary, please call 301-791-6360. I know I'm looking forward to it. I hope you are too. Stay with us. We'll be right back.
People don't realize it takes a lot to care for a family member in your home. John's dad was very headstrong, so I think that was a lot for him to get over and try to come to terms with that he had terminal illness. I would recommend everybody to get hospice involved at the get-go. When you first learn about it, get it set up. It's going to make it, I mean, it's terrible what you're going through already, but it's going to make it easier for you in the long run because we couldn't have done it without them.
Call Hospice today. Hospice of Washington County, when time matters most.
Harbor's Carsons Jewelers has been your community jeweler for over 110 years. We have the region's largest selection of diamonds, designer jewelry, including bridal, gold, and silver fashion jewelry, and fine Swiss timepieces. We strive to combine quality, expert personal attention, and affordable financing to create an exceptional shopping experience aimed at exceeding your expectations. At Carsons Jewelers, there's something for everyone that will bring a smile to that someone special in your life.
From the smallest item of jewelry to the largest ceramic elephant, every 10,000 Villages handcrafted product makes a remarkable journey.
All over the world, our products travel similar paths, over thousands of miles and years of artistic tradition. Our handcrafted gifts represent work that builds villages and sustains souls. They are the dream of a better life made real. Every product is a miracle.
Hi there. I'm glad you're still with us. It's now my pleasure to welcome Tracy Simane to Healing, Hope, and Help. Tracy leads a very busy life. She's a wife and a mother, and she also supervises a dental practice. With all that going on, I'm grateful to her for making time to join us today for today's program to talk about the care and support her father and family received from Hospice of Washington County. Thank you, Tracy.
Thank you for having me.
Sure. Let me start off by just saying I'm sorry for your loss. And I'm glad that Hospice was there for you. Maybe you could tell us when and where Hospice served your father.
My dad got sick in September of 2013. Hospice came into our lives probably around October, and then he passed in December of 2013.
And was he cared for at home?
He was cared for at Meredith Hospital and then at home.
Okay. And can you talk about the different care providers who came in and made a difference in his life and in the life of your family?
We had a great team from Hospice. It consisted of nurses, a chaplain, we had a social worker. There was also a physician in the background, so we weren't all left medically by ourselves. We had a huge team that helped us.
And what kinds of things did the certified nursing aide assistant do for you?
The aide came in and she would bathe my dad.
But made it so it was supportive to him.
Yes, supportive to him.
And he didn't feel embarrassed.
Right, and he didn't feel embarrassed.
I know that one thing that people tell me frequently is when they're at home caring for a loved one, and we experienced this with my dad, he didn't want his children to bathe him, but to have somebody who was tender yet professional really made a difference.
Yes, it does make a difference.
Yeah. And did your family feel supported by the Hospice team as well?
They did. They supported us medically, they supported us spiritually, and they supported us,
I'm sure, emotionally.
Yes,
and
emotionally, yes.
What would you say to someone who is, has a sick relative or loved one who is thinking about having Hospice come in but maybe hesitant to do so?
Get them sooner. Get them sooner than later.
And why do you say that?
Because there's so much that they do for you and your family that you don't even realize that you need that support.
One of the things that I think is interesting is they actually did a little bit of research, and patients who receive hospice care actually live longer because their pain symptoms are better managed, and because they can see that their family support it, they don't feel like a burden. So I think that kind of goes along with what you're saying.
That's exactly right.
Yeah. And Tracy, I was wondering, have you ever had a chance to talk about your dad and his experience with hospice before?
I have. Last year I had the privilege and honor to talk about my dad at the Gift of Hospice, and it was such a rewarding experience, plus also helped me with my healing.
Okay.
And also to share with everybody what hospice was about and what my dad was about.
Right, you really got to honor him. I remember
did.
how nice that
Yeah.
was. And Tracy, did your family take advantage of, either you or other members of your family take advantage of the bereavement support that's offered by Hospice?
We did not, but I have heard so many wonderful things about bereavement. And I've had other friends that have lost family members that have taken advantage of bereavement and have been totally satisfied.
Okay, that's great. Well, thank you so much for being here.
Oh, thank
I really
you.
appreciate it.
Thank you.
I'm so grateful to Tracy for being with us. Her words are all the more powerful because she speaks from a place of knowledge based on personal experience. I'm also grateful to Tracy for telling her story at last year's Gift of Hospice, which was both inspiring and moving. This year's theme for the Gift of Hospice is Harvesting Seeds of Hope, and will again feature hors d'oeuvres and music by Grammy-nominated singer Karen Taylor-Good. No doubt guests will be inspired by both the music and the short presentations made by individuals who, like Tracy, are willing to talk about the positive difference hospice care has made in their lives. The Gift of Hospice will be held on Tuesday, November 10th at Fountainhead Country Club. The doors are open at 5 and the program begins at 6. Although the event is free and open to the public, advance tickets are required because seating is limited. If you want to have an enjoyable evening while learning more about the services provided by Hospice Washington County, please call today 301-791-6360. We'll be right back after this short commercial break.
Harbor's Carsons Jewelers has been your community jeweler for over 110 years. We have the region's largest selection of diamonds, designer jewelry, including bridal, gold, and silver fashion jewelry, and fine Swiss timepieces. We strive to combine quality, expert personal attention, and affordable financing to create an exceptional shopping experience aimed at exceeding your expectations. At Carsons Jewelers, there's something for everyone that will bring a smile to that someone special in your life.
I'm the hometown favorite.
I'll outsmart you.
I will beat you.
I'll be surrounded by fans cheering me on.
There's no place like home for fighting cancer.
My turf.
My time.
My team.
Expert care. Close to home. The John R. Marsh Cancer Center at Meritus Health.
From the smallest item of jewelry to the largest ceramic elephant, every 10,000 villages handcrafted product makes a remarkable journey.
All over the world, our products travel similar paths, over thousands of miles and years of artistic tradition. Our handcrafted gifts represent work that builds villages and sustains souls. They are the dream of a better life made real. Every product is a miracle.
People don't realize it takes a lot to care for a family member in your home. John's dad was very headstrong, so I think that was a lot for him to get over and try to come to terms with that he had terminal illness. I would recommend to everybody to get hospice involved at the get-go. When you first learn about it, get it set up, it's going to make it, I mean, it's terrible what you're going through already, but it's going to make it easier for you in the long run because we couldn't have done it without them.
Call Hospice today. Hospice of Washington County, when time matters most.
Welcome back to Healing, Hope, and Health. It's my pleasure to introduce Bill Deidelbis, one of Hospice of Washington County's 11th hour volunteers. No one is born alone, and in the best of circumstances, no one dies alone. But once in a while, a patient is admitted to hospice who has neither family nor friends that can be with them as the end draws near. Hospice of Washington County's specially trained 11th hour volunteers provide a reassuring presence to these patients, and will also vigil with their patients and families when they are interested in additional support. Bill, prior to retiring, worked at Rose Hill Cemetery. He's married to his wife of 47 years and has 2 children and 3 grandchildren. In 2013, he began volunteering for Hospice Washington County, and then just last year, he took an additional training so he could serve as an 11th hour volunteer. Bill joins us today to talk about his reasons for becoming an 11th hour volunteer and a little bit about his experience. Welcome, Bill. Thanks for being here.
Thank you, Bernadette. Glad to be here.
Good. So you could have volunteered with many different worthy nonprofits. Why did you decide to donate your time to Hospice of Washington County?
Well, when I worked at my previous job, I'd always enjoyed working with people, having to help them because this was their worst time that they could ever experience. And of all the different organizations that deal with that type of situations, hospice was the one. And I had it in my mind many years ago that when I retired, that one of the first things I wanted to do was to try to become a hospice volunteer. It meant a lot to me to be able to help people, to encourage them, to make them feel a little better. That's the reason why.
Well, that's great. And did you go through training, regular volunteer training, and then additional 11th hour volunteer training?
That's what I did.
Okay.
Yes.
And I don't know too much about the 11th hour volunteer training. Perhaps you could tell our viewers a little bit about that.
Basically, it's a training whereby you go into it and they give you the situations where a lot of the patients that you have are comatose. They're not awake, but yet you know in your heart they can hear you. And this is important because these people need to know that someone is still out there for them. And this training sort of helps us adjust and be ready in case something does happen to them, because 11th hour means just that. They could pass away at any time. And like you said at the beginning, for someone to pass away alone has to be the worst thing in the world.
And so you are that reassuring presence for those patients. Do you, when you're an 11th hour volunteer, is it most of the time that you're the only one there, or are you often there with
a lot of
friends
times,
and
yes,
families too?
because most of the time, but fortunately here lately, I've been a late shift, like 7 to 11 or 8 to 12, the late shift, and most of the family has already gone home.
Okay.
So there's nobody there. I have had the privilege of being able just to be with them, being able to talk to them, being able to speak with them, even though they can't speak with me.
Yeah, so you're that reassuring presence,
Right.
whether they're talking back or not.
Right, and I even asked them, I talked to them just like they were awake, what did you enjoy, what did you do in your lifetime? What were your enjoyments, what were your hobbies? I knew they weren't going to answer me, but I was asking them.
Right.
And I would even sing to them.
That's great.
So.
And Bill, obviously you have this gift to be present to others, and that's something you give to them. What do you get out of being there for them? What does
do
it
I
do
get
for
out
you?
of it?
Yeah.
I can't even express it. It's to sit there with them and to talk to them and to look to them. Well, almost everyone I've been with, I cry over, because I look at them and say, except by the grace of God, that could be me laying there, and I'd want somebody here for me.
Right.
And the presence, just to be there, to know that you made a difference.
Right.
That's what it's about. You make a difference. That's what hospice is. We're here to make a difference, and that's very important.
Okay, that's great. Thank you so much for sharing that. Bill, what would you say to someone who is considering being an 11th hour volunteer? Is it for everybody, or?
No, it's not. A hospice volunteer.
Hospice volunteer is a broad category.
Broad category.
Lots of different ways to be
Absolutely.
involved. But 11th hour
But
volunteer.
11th hour, it takes a person that doesn't mind knowing that the person they're sitting with may be with you and then not with you. You have to be able to know that you can deal with a situation if someone passes while you're sitting there with them. You have to know that you can accept it and not let it eat you alive. You can do that. And you have to be able to do that. I didn't think I could do it, to tell you the truth, whenever Earl August asked me, but the more I got involved, the more I'm glad I did.
Well, thank you so much for doing it. It's a gift that you share with our community.
Thank you.
Whether patients are alone or surrounded by nursing staff, friends, and family, the presence of 11th hour volunteer provides patients with the most valuable of human gifts, a dignified death. I'd like to thank Bill and all the others who serve as 11th hour volunteers for their commitment to Hospice Washington County and their service to our patients. If you are interested in serving as an 11th hour volunteer, please contact Lindsay Anderson at 301-791-6360. Thanks for joining us today. We'll see you next time.
Looking through the lens, I see you smiling there. I take a photograph.